Measles is an ancient disease, and pinpointing the exact moment of its discovery is difficult. However, it is believed to have been first described by Persian physician Muhammad ibn Zakaria al-Razi, also known as Rhazes, in the 9th century AD. He provided a clear distinction between measles and smallpox in his medical writings. Measles is caused by the measles virus, MeV, which is a member of the genus Morbillivirus within the family Paramyxoviridae. The disease has been present throughout human history, and its impact on populations has been significant, especially prior to the development of an effective vaccine. In 1963, the first measles vaccine was introduced by Dr. John Enders and Dr. Thomas Peebles, which has greatly reduced the incidence of the disease worldwide. Measles is a highly contagious viral disease that primarily spreads through the respiratory route. The measles virus is transmitted from person to person via respiratory droplets, which are expelled when an infected person coughs, sneezes, or talks. The virus can remain airborne and infectious for up to 2 hours in the airspace where the infected person has been. A susceptible individual can become infected by breathing in the virus-containing droplets or by touching a contaminated surface and then touching their eyes, nose, or mouth. The virus enters the body through the respiratory tract, nose, mouth, or throat, and starts infecting cells, eventually spreading throughout the body. The contagious period for measles begins about 4 days before the onset of the characteristic rash and continues for about 4 days after the rash appears. This means that a person with measles can spread the virus even before they know they are infected. Measles is so contagious that up to 90% of susceptible individuals who come into close contact with an infected person will contract the disease if they are not vaccinated or have not previously had measles. Measles symptoms typically appear around 10 to 14 days after exposure to the virus. The initial symptoms are often similar to those of a common cold and may include high fever, a fever of 101 degrees Fahrenheit, 38.3 degrees Celsius, or higher, which may last for several days and may peak as high as 104 degrees Fahrenheit, 40 degrees Celsius. Cough, a dry and persistent cough. Runny nose, also known as coryza. This symptom involves nasal congestion and discharge. Conjunctivitis, red, inflamed, and watery eyes, often accompanied by sensitivity to light. Sore throat, pain or discomfort in the throat. 2 to 3 days after the initial symptoms, tiny white spots with bluish-white centers called Koplik spots may appear inside the mouth, usually on the inner cheeks. 3 to 5 days after the onset of the initial symptoms, the characteristic measles rash appears. The rash typically starts on the face and gradually spreads downwards to cover the neck, trunk, arms, legs, and feet. The rash is usually red, blotchy, and slightly raised, with individual spots sometimes merging to form larger areas. The rash typically lasts for about 5 to 6 days before fading in the same order it appeared. As the rash appears, the fever may spike, and the infected person may feel extremely unwell. After the rash subsides, the person usually starts to recover, though complications can arise in some cases, especially among young children, pregnant women, and people with weakened immune systems. There is no specific antiviral treatment for measles, as it is a viral infection. The primary focus of treatment is to relieve symptoms and prevent complications. Supportive care and management of symptoms are essential in helping the patient's immune system fight off the infection. Some general measures for treating measles include rest. Encourage the infected person to rest and sleep to help their immune system recover. Hydration. Ensure the patient drinks plenty of fluids, such as water, fruit juice, or oral rehydration solutions, to prevent dehydration caused by fever and loss of fluids. Fever management. Use over-the-counter fever reducers like acetaminophen, Tylenol, or ibuprofen, Advil, to help lower fever and alleviate discomfort. Aspirin should not be given to children or teenagers due to the risk of Reye's syndrome, a rare but potentially life-threatening condition. Cough relief. For older children and adults, cough medicines or lozenges may provide some relief from a persistent cough. For young children, consult a healthcare professional before administering any cough medication. Eye care. Clean the eyes gently using a soft, damp cloth or cotton ball to remove crust and discharge. Avoid rubbing the eyes. In some cases, Healthcare providers may prescribe vitamin A supplements, particularly for children with low vitamin A levels, as it has been shown to reduce the severity of measles and decrease the risk of complications. It is important to monitor the patient for any signs of complications, such as difficulty breathing, severe cough, high fever, or signs of encephalitis, inflammation of the brain. If any of these symptoms develop, seek immediate medical attention. Prevention is key to avoid measles, and vaccination with the measles, mumps, rubella (MMR) vaccine is highly effective in providing immunity against the disease.